Well, hello, Dr. McVean, Jen.
Hello, Marissa. It's so great to see you.
It's great to see you. I'm really excited to have this chat with you, and I'm so excited about everything that's going on with Medtronic, which will help people's lives get a little bit easier with diabetes. But I
Me
wanted to go
too.
ahead and start with if you want to just tell us a little bit about yourself so that our CWD viewers have an idea of who you are.
Yeah, absolutely. So, hi, my name is Jen McVean. I am a pediatric endocrinologist and one of the medical directors at Medtronic. I became a pediatric endocrinologist because I was diagnosed with type 1 when I was 11. And I have now lived with type 1 diabetes for 36 years. So, you can do the math on how old I am. Outside of my professional career, I live in Minnesota with my husband and three children and dog. And I love to do all things outside, summer, winter, you name it.
That's awesome. Yeah, I'm coming up on my 35th year in September. So I hope you've gotten your Journey Award. I'm sure that someone has given it to you.
I have a 10 year and I also have a 25 year.
Yeah.
Now I have to wait a few more years to hit hit the 50.
Yes, I know. I'm trying to convince everybody to like let's find a gap in there and fill it.
Right?
We'll see.
Because living with diabetes is hard and we deserve to be rewarded.
I know. Like it doesn't have to be annually,
No,
but maybe every decade. I don't know.
I like it. I like the decade.
I'm gonna try. Um, so I wanted to sort of get into some of the things that Medtronic is doing that's really helping make life easier with diabetes. You guys have been on the forefront of automated insulin delivery. You were the first hybrid closed loop to market, correct?
Yes.
And the first CGM to market, right?
Yes. Now, I think I was back in residency maybe when that first CGM came, but I certainly remember the first AID system that came to market from Medtronic in the US in 2017.
Gosh, okay, so it's been 7 years at this point, and there has been a whole lot of progress. Like it went from we will suspend on low to we are going to do all kinds of different things. So, how about just tell me a little bit about how the 780G system works in general so that people have a good idea going into it?
Absolutely. So, as you mentioned, we are incredibly proud at Medtronic to have been pioneering automated insulin delivery systems. And for maybe some of those newer people with diabetes and families, so an automated insulin delivery system is an insulin pump and a continuous glucose monitor, and then the algorithm, which is the invisible piece behind the scenes that is leading to the delivery of insulin. And the MiniMed 780G system is an advanced hybrid closed loop algorithm. So it's second generation. And it basically provides background insulin or auto basal every 5 minutes. And then, in addition, what's really quite new and revolutionary is that it also has the ability to deliver auto corrections every 5 minutes as needed as well. And this is really important for those times if people with diabetes forget to bolus or undercount carbs. Also, if you eat something really high fat, high carb before you go to bed, those auto corrections are able to kind of kick in all night long and keep more of those glucose values in range. The other thing that the 780G has, it has adjustable targets as low as 100 milligrams per deciliter. So that is incredibly exciting as well. One of the things that is incredibly exciting, we have published data now on over 100,000 people living with diabetes using the 780 who are actually using that lowest target of 100 milligrams per deciliter. And then an active insulin time of 2 hours. Those are kind of the recommended settings for the 780. And what we're seeing with this group of adults is 80% time in range. So 80% time in range for those adults who are using the recommended settings, which is just really life changing. And it's not just in the numbers. You and I both know how miserable highs and lows feel. And so when you're spending the grand majority of the time in the target range between 70 and 180, you just feel better.
Right? I think it's so interesting. It's honestly amazing and frustrating how much your body can compensate, and this is why, slower onset type 2 is harder to catch, right? Because, your body acclimates and you get used to feeling a certain way, and I work on this with some of the kiddos I see in clinic who are typically running at, 2 to 3, even higher 100. And, then they start to feel low much at a much higher level and you have to kind of gradually go down. Um, but it's a lot of work, right? And I think that's what the 780G is trying to achieve automatically so that their burden is less on the person and we're, able to use this technology.
I think that's the key, Marissa, is we know the burden of living with type 1 diabetes. All the things that the person with diabetes and their family and their village have to do multiple times a day, and not just during the day, at night. And that is really where the 780G shines, is in taking a lot of that workload off of the person with diabetes and their family and their caregivers. In a lot of different pivotal trials and clinical trials that we've done, we've heard from the study participants that sometimes they forget they have diabetes,
Oh,
or it's the closest thing to a diabetes holiday that they've ever experienced. And that's really our goal, is to help people with diabetes just live their lives and be able to put diabetes in the background and just life in the front. And I know
right.
you and I, both having lived with diabetes for, approaching 4 decades, we know what that journey is. And we know that with increasing automation and improvements in technology, how much easier it's gotten. Type 1 diabetes is still never easy, and there's still work for the person with diabetes, but we're incredibly excited about how much of the burden the MiniMed 780G can take away from the person with diabetes, and how much life and time and energy it can give back.
Right, right. Well, and I think too, something that I've, experienced with the automated insulin delivery systems is it's not that it's that much work to do things, right? Like the diabetes tasks, like changing the infusion set, changing the reservoir. It's not that much work. It's just the amount of little tasks that add up throughout the day is like cumulative, right? And that's really where, even taking away something from that perspective is really helpful. And one of the things that I really enjoyed when I wore this system was the 7-day infusion set. So I wanted to ask you sort of what your experience has been with it, what you've heard from people, so that we can better understand.
I'm always really excited to talk about the extended infusion set, because this is something where it's like you said, there are so many different tasks with diabetes. And so there is a PhD scientist in his team, Dr. Chattaraj at Medtronic, who spent a decade working on this problem of infusion sets, right? The typical infusion set only lasts 2 to 3 days, and the person with diabetes is constantly having to change that out. And so they really looked at, how do we make an infusion set that can last for up to a week? What are the different things that we have to accomplish to make that true? And I like to tell people that what goes behind it, because it isn't just a 2 to 3 day infusion set that we slapped extended onto. It was a huge, amazing scientific project, a 10-year science project that led to something absolutely phenomenal. And so when you look at the infusion set itself, the HCAP connector is different, and so it's able to filter out more of the particles inside the reservoir, as well as inside the tubing. That's also different material that leads to less preservative loss of the insulin and more stability of the insulin. And then the patch, right, where it sticks. People with diabetes amazingly do all sorts of things in all sorts of things in all sorts of climates. And so that patch has to stick. So it's a completely different adhesive that is also able to stick for up to 7 days. And what are we hearing? We're basically hearing like, it's amazing. I it's one less thing that I have to do. And even for people now, our reservoir holds 300 units.
Mhm.
So, but even people who use more than 300 units in 7 days, there's a process where you can just swap out the reservoir midweek and you don't have to change the whole set. And so it's really exciting. And of course, we are, making as many of them as we can, as quickly as we can. And it's, here in the US, it's in many places around the world. It's not everywhere yet, but we're trying to get everywhere. And my position at Medtronic is global. I'm the only pediatric endocrinologist that Medtronic employs. And so sometimes I'm in locations where they don't yet have it. And there's just a lot of, everyone
FOMO?
wants it. Yeah, a lot of FOMO.
Yeah.
And I'm like, okay, we got to get it to you as soon as we can, because it really is making life easier for people with diabetes.
Absolutely. And, I think one of the things, like when I wore the system, I was really worried because I've worn a pump for, gosh, almost 26 years. And so scar tissue is a challenge, right? And I've been using different locations, et cetera. But I was really worried, like, well, is this going to work for me? Like, or do I have too much scar tissue? And I found that it really did work when we did when I tightened up the insulin action time and lowered the target, because I was having highs and I was changing the infusion set like I would in a traditional because, when in doubt, change it out, right? That's what we've been
Right.
taught. That's the mantra. And, when it does only last 2 to 3 days expected, that is what you do. But when you're expecting 7 days, you just have to make sure your settings are actually appropriate. Turns out.
Well, one of the things when you're talking about highs and knowing when to change it out, and this is a little bit of a tangent, but I think it's really interesting because really, what's our goal at Medtronic? It's to decrease burden for the person living with diabetes, right? To make, so they don't have to think about it so much. And one of the things with the 780, when do you want to be alerted and alarmed by your system, right? Basically, if you need to take action, that's when you want to be alerted. I don't want to be alerted if I don't need to do anything. And because of the auto corrections every 5 minutes, our suggestion with the 780 is that you actually don't necessarily need to set the high alert. And the reason is that if the person with diabetes is 250 or higher for 3 hours, it will automatically alert, right? That's just hard set into the pump. And because it's auto correcting every 5 minutes, somebody, if it's needed, somebody with diabetes using the 780 really shouldn't be over 250 for more than 3 hours. And then if that person is, then yes, they should be alerted. And then maybe they need to think about, okay, do I need a new infusion set? What else is going on?
Right.
So yes, absolutely. Well, I'm so glad that you had such a great experience with it.
Yeah, I really did. I loved it. I also love just the way that it's designed. It's much easier to use than like I guess it's like the inset 2 instead of the inset 1 or whatever, right?
We had previously, we had Quickset and
Yes.
we had Mio, and then this is actually built, the platform was called Mio Advance, which
Got
we
it.
had a little bit before we had the extended infusion set. But you're right. I mean, shoot, I should have, well, actually, this is really funny. I'm sitting at my desk and I need to change my infusion set today. And so sometimes I hate to admit this, if I'm on a call and I just take care of it. But
Oh, 100%.
it's super easy. I actually didn't do this on purpose, but oh, I don't know if you can really see it.
I think I can see it. Yeah.
Yeah, all you do is you basically take that out, you take the tape off, right? And then you stick it on and push the button.
Yes.
Like I mean, you saw that, right? And I'm really proud of Medtronic for that, because that is like, when I think of earlier infusion sets,
Yes.
it is so much easier, very
It
quick.
is. Well, and I mean, imagine, I always worry about people when we're training them on new pumps, how to use the infusion sets. It's complicated. If people have dexterity issues, it can be overwhelming just in general, having to learn. You're already thinking about like, oh, I'm going from basal bolus to, the insulin pump. This is a whole new thing, right? So I love anything, that we can streamline, make
Make it easy.
simple. Yes, absolutely. So I have a question about the missed meal detection. Can you tell me a little bit more about how that works? I know you've sort of mentioned the auto corrections every 5 minutes, but I am aware that you have a specific sort of missed meal detection in the algorithm.
Yes, this is really exciting. This is also pretty revolutionary with the 780 because it is the only system that has the meal detection technology. So, all right. So the person with diabetes is living their life. Maybe you and I, Marissa, like we go out to dinner and we're just chatting and having a great time. And I forget to bolus. And I'm just sitting there enjoying my evening, enjoying my food. And what happens then is the system is always looking at, what's the current sensor glucose, what's the trend, and it's comparing that to past sensor glucose patterns. And when it detects a, very sharp rise,
Mhm.
it knows that a meal has been missed. And so building on the fact that the system can auto correct every 5 minutes, what the meal detection does is it allows a bigger auto correction in order to minimize that glucose spike and to bring the glucose back down into range, or sometimes even keep it from getting out of range more quickly. And when we were testing the MiniMed 780G, the FDA required us to do some missed meal challenges. And we have some examples. There's one example of a gentleman who ate 75 grams of carbs, and he was using the settings, the recommended settings, as I mentioned earlier, are an active insulin time of 2 hours and a target of 100. And so he was using those settings, and he ate the same meal 2 different days in a row. And so it's super fascinating because the first day he was just using the system in manual mode. And so he didn't have the meal detection.
Yeah.
And he went up to like between 300 and 350. And then the next day he was using it with the smart card and had the meal detection. And he got like 8 auto corrections in about an hour or so. And within 2 hours, he was back down to like 130 or 140. And so, of course, the system works best when people with diabetes count their carbs accurately and remember to bolus. However, we all live in a real world where we know that we don't always remember to bolus and we don't always count our carbs 100% accurately. And the system is there and it has our back. And I think that's one of the things that I just love the most because I just don't have to worry anymore.
Right.
I just, and I'm pretty good about bolusing. I bolus before
Of
most
course.
of my meals, but is my accuracy the best? To be honest, who knows? I
Right?
mean, I, a lot of times I was in the last month, I was in Japan.
Wow.
And yeah, I mean, that food over there is very different than what I eat on a day-to-day basis. And,
Right.
this system took care of it.
Yeah, and you're in a totally different time zone. Your body doesn't know which way's up, which way's down.
Right?
There's too many variables. That's really the thing.
There are
So,
so many variables. So it's really nice to have a system who's working in the background, dealing with the blood sugar and making adjustments so that I don't have to worry about that.
right, right. Well, and I think too, I think what gets really challenging emotionally with diabetes is when you're working really hard, like you're counting the carbs, you're measuring, you're doing your best to get an accurate, right, whatever accurate is, assessment of your carbohydrate count and the fat and protein intake and blah blah blah. And you're doing all of that work and maybe sometimes you get it right and you end up right where you thought you were going to go. And I think that's one of the things that's so nice with these systems is you're not having to put in as much work. So you're less irritated, right? Because you don't, it's like you haven't put in quite as much effort, like you've done what you needed to do, right? But you're not working so hard for nothing, right?
And the result is consistent.
Yes.
Every morning, like it doesn't really matter exactly where I go to bed. Every morning, I wake up somewhere around 100. I
Right.
mean, I think of all the years, Marissa, I'm sure you did too, of that is not what would happen, right? You go to bed at one number and even if you went to bed at the same number every night in the past with MDI
Right.
or before automation, one morning you end up in range. The next morning you're high as a kite. The next morning you're low, right?
Yep.
To be able to go to bed, put my head on the pillow, I usually look at what my number is before I go to bed. I think that's good practice for
Yeah.
people with diabetes. But that's it. I look at it, okay. And I know the next morning I'm gonna wake up somewhere around 100 and typically sleep through the night, which is amazing.
Yeah. And then, you're not getting, so I just did a little bit of research about diabetes and sleep. And it's, much like depression and diabetes, where like they just negatively affect each other, right? It's the same with sleep. right? And so obviously the interruptions are challenging, but not only is it like more tiring, but it also can negatively impact your blood sugars the next day. And those interruptions and or dysglycemia, like blood sugars that are out of that 70 to 180 time in range we talk about, can actually make your sleep less deep. So you're not only getting like less interruptions, but you're probably getting like good quality sleep.
Sleep. And I'm so glad you brought up sleep. This was actually one of the things that we looked at for an abstract this year at the American Diabetes Association. So we looked at we have this huge CareLink database system. So people with diabetes using Medtronic pumps and AID systems who, agree to have their data stored in an anonymized fashion, right? Like, so we pulled up data from our previous system, the 770, which was just auto basal only. And then we looked at the same people using the 780, and we looked at what happened overnight. And what did we see? We saw like decreased alerts and alarms, increased uninterrupted sleep. And so overall, it was 30 minutes more of uninterrupted sleep with the 780. And then those using recommended settings, it was 36 minutes, which when you add that up over the course of a year, that
Yeah.
is a lot of extra sleep.
Right.
So I think that is one of the other things that where the MiniMed 780G really helps is with sleep.
Yeah, absolutely. And we're just nicer, happier humans when we get our
Get a
sleep,
good night
right?
of sleep. I know.
Everything works better. I don't know. Um,
Absolutely.
so with this missed meal detection and the auto corrections, is there an increased risk for lows? I know you've talked a lot about having increased time in range, but is there also an increased risk for lows?
Great question. And a lot of times when I'm talking about the auto corrections and the meal detection, people ask that question. They're like, wow, like, uh, does that lead to insulin stacking and that kind of thing? There is not an increased risk of lows. And let me tell you a few different things. So there is a predictive algorithm before any auto correction dose is given, where the system actually looks a couple hours into the future to see if a low is predicted. And before it delivers that dose, if a low is predicted, it will cut back on the dose. So the person with diabetes doesn't have to like, they're just living their life.
Right.
The mathematical algorithm in the background is doing this. So it does not deliver an auto correction that's predicted to lead to a low. Same thing at mealtime. There is a predictive algorithm that actually looks 4 hours into the future. And if a low is predicted, it will cut down on the dose of insulin. And so we have not seen an increased risk of lows with the 780. What we're really able to do with the 780, when you look at that, graph of the red being low, the green being in range and the yellow being high, the time in range really has, for the most part, increased because we're cutting down on that yellow bar. We're making the green bigger. And in some situations, a little bit off of the red as well. When we looked at a really early group of people from Europe, because they've had the system longer than we have, we're celebrating about 15 months or so, but it's been in Europe for almost 4 years. When they looked at the initial group of people, they split it up into quartiles of time and range, like people who started before 780 at the lowest time and range to the highest time and range. And when you looked at when they went to 780, everybody had an improvement. Now, the people who started with the lowest time in range actually had the biggest improvement in time in range. But the
Yes.
people who actually had the highest time in range to begin with, their time in range went up even further. But in addition, their time below range actually dropped by almost 1%. So with the meal detection and auto corrections, it's the things are built into the system to avoid as many of those lows as possible.
Yeah, and that's one of the challenges before automated insulin delivery systems, right? Before we had low glucose suspend, the tighter in range you were trying to get, the more lows you tended to have. It would be nice if this were just a little bit easier, but here, this is what we got. So,
Oh,
uh,
if type 1 diabetes was a little
yes,
easier, yeah,
yes,
that would be great. You
that
and
would
I
be
would both
great.
be out of a job, but you know what? Actually, I'll take it. That I would
Yeah,
find something else to do.
absolutely. So, what about sending data to your physicians? You mentioned that there's the option in CareLink to like anonymize your data and use it for research. That's amazing. And
Well,
can you,
not for well, I guess. Oh, I guess it's not really like research, but like just a
but like
report. Yeah, yeah, yeah.
yeah, past retrospective data, right? Looking at the past.
Retrospective. Yeah, yeah, yeah.
Yes, yes. But what about sending data to your healthcare professional? Because that's something that it should be streamlined. It would be nice.
Yes. So with the MiniMed 780G, there are a couple different apps. There is the MiniMed mobile app. And so that is for the person that is living with diabetes. And when they have, when they're using the MiniMed mobile app, you can see all of your insulin information, your glucose information, all of that on your phone. And it's also going up to the cloud. And so your healthcare provider can also see that at any time. As a pediatric endocrinologist, I also think it's important for, and I know you're a pediatric educator, to recognize the village of people surrounding not just children with diabetes, adults with diabetes as well, but especially children. There's another app that's called the CareLink Connect app, and that is for care partners. And so each person with diabetes can have 5 different care partners. So little Johnny might have his parents following, and perhaps the school nurse, and maybe grandparent, maybe a soccer coach, whatever it might be. But for the physician, yes, if the person is using the MiniMed mobile app, the information is going up to the cloud so they can access it easily.
Awesome. Okay. And if you're the caregiver or loved one of someone with diabetes and you have the Connect app, Connect, right?
Connect,
Do
yep.
you get alerts? How is that set up?
Yes, you get alerts. It also mirrors what the person with diabetes is seeing as well.
Oh, right. So then, yeah, because this is huge actually. And this my partner really really loved this about this system, being able to see, oh well, Marissa's trending up, but I see that she gave a bolus. It's doing automated delivery. It's going to bring her right back down. He actually saved me from having a sensor go bad when I was going into clinic. Sent me a message like, hey, your sensor's going to die in a couple hours, aren't you going to clinic? Maybe you should take another one. And I was like, wow, all right. I mean, what
So
a helpful thing to have.
it's really nice to be able in one app to see all of that, the battery information, the
Yep.
glucose information, the insulin information, all of it. And it's funny what you said about it was the end of your sensor life, because that is really when people are not in automated mode. The main reason that we see with the 780 is because they go off to work or school.
Yep.
It's the end of their sensor life, and they don't have another one.
Right.
So, yeah, so that's awesome that your husband, I don't think I knew that story. That's a great
Yeah.
story. Use the app to alert you, like, hey, you need to put a new sensor in.
I know because, I just wasn't thinking about it. We can't think of
Which
all the,
actually I kind of love, right?
right?
Like you were just doing your life,
Yeah.
and right, your system was doing diabetes, and your husband, part of your diabetes village, was like looking out for you. I love that.
Yeah. No, it was really helpful. And I think it's interesting, now that we're talking about this. I mean, this is sort of new that we have automated delivery systems, 7 years, right? But being so, in the beginning, we were like, oh, this is great. But now we're very dependent on our CGM, right? Like life without CGM is like unthinkable, I think sometimes. And I wish everyone had access. I hope we can get access for everyone worldwide. Um, but this is something like instead of just checking before you leave for, work in the morning, or you checking your kiddo before they go to school to make sure they're going to have enough insulin for the whole day in their pump, you also need to check that sensor life, right? It's just something we
It's
have to add to that checklist.
we you are right. CGM, it is interesting to think back. I know you and I both lived with diabetes for a number of years before CGM, and it's a bit hard to imagine that now. It's kind of funny, it's back to school time of year, and I remember I grew up outside of Minneapolis, and I went to college in Chicago. And I remember my family like packing up the minivan and they dropped me off in the fall of 1994. There was no CGM, right? And so I fortunately, fortunately I made it. But now just it's really nice to not only have CGM, but also automation. So when you think about these major transitions in life, like going from high school off to college, that there's, the person with diabetes is going to be, they're going to be as safe as possible.
Yeah.
And that their parents back home, if they want to look, they have that ability to be connected.
Yeah, and I really think, and I don't know if y'all are studying this yet, but I really think that having the app showing the insulin dosing and the CGM values is going to like decrease family conflict around diabetes because I hear so much from teenagers, from even younger kids that, most of their frustration is their parents texting them asking, did you bolus? I see that you're high, what's happening, etc. But when you have more of that data for the caregiver, that changes the whole dynamic. They'll see, oh, well, they bolused. And so then they can see, oh, well, it bolused these number of times, like, and they're still high. Maybe we want to look at that infusion set. Maybe, like what else is going on? Are you dehydrated? Are you sick? Et cetera, et cetera.
I think you've really hit on something, decreasing diabetes conflict, especially, you think in teenagers as they're, I mean, we know how that is teenagers have to make the transition. When you're 9 or 10, your parents are doing most of the management. And then by the time you go off to college, the young
It's
adult
you.
needs to be doing it. And even with some of the fewer alerts and alarms with the 780, I mean, here's the thing.
Yes.
Okay, the teenager goes out and has pizza with friends, 10 o'clock, 11 o'clock at night. Hopefully boluses some, right? But we know what pizza can do.
Yeah.
Even if you bolus, you can be high later on, right? And then that can lead to alerts, alarms, and all of that. But with the meal detection and auto correction capability of the 780, mom and dad are sleeping through the night because they're not being alerted. The teenager is sleeping through the night and the system is working in the background, like hammering, right? Like all night long. I love to tell this story because I would say I avoided carbs for many, many years. And some of that, unfortunately, was just when I was diagnosed in the late 80s. I was initially told, like, you really need to kind of restrict carbs, and that doesn't lead to healthy eating or whatever. But so I still watch carbs, but I eat a lot more carbs than I used to. So a few weeks after I got in the 780, I was up late one night working, and I was like, wanted something like I had got a Diet Coke and I wanted something salty. And so I see the usual suspects, the dill pickles, like the meat sticks, all that, right? And in the corner of my eye, I see this bag of Sun Chips, like like the cheddar ones. I don't know if
Oh,
you like
yeah.
those. I
They're
love
good.
them. Okay, so basically, I grab the bag, I go back to my desk, I eat half a bag of Sun Chips, which literally was probably more chips than I had eaten combined in the last 20 years. I'm
Oh
not
my
kidding.
gosh.
And then I did bolus,
Yeah.
probably not enough. I went to bed, and guess what happened?
Woke up in range.
Nothing happened. Well,
That's
the
awesome.
the system worked all like night long, but like when I looked at all those auto corrections, I was like, oh wow. But yeah, I woke up. I woke up in range, and I was like, oh my gosh, that that is life changing.
That is, because I mean, that changes your whole relationship with food.
Food, right?
Yeah, and I love that you can eat carbs now. Oh my
I
gosh.
I used to like when we would go to there's a really cute Ben and Jerry's that my family and I go to sometimes, and I would like never get my own. Right? I would eat a bite of everyone else's, but I'd never
Right.
get my own. And so now I feel like, oh, I can get my own.
Yeah, heck yes, you can.
So yeah, so I love it. I love it.
Oh, I mean, that's a whole thing I didn't even think about with this system. It's going to give people so much ease from things that, were previously really difficult, right?
Right. And now, of course, the other thing, okay, I can't just do that and not be mindful of my activity.
Well, I mean, yeah, you're also human and need to be,
Yeah, right.
you want to
But
be a healthy human most days.
yes, but it is yes, that has really been that is life-changing. It's like
Yeah.
whatever the system, I mean, I am a doctor and all of that, whatever the system is doing in the background, it makes it so that I can enjoy ice cream with my family, or I can, make a bad decision eating half a bag of chips before I go to bed, which was really delicious.
Yeah. And I mean, gosh, that's so beautiful. I really love that. It's like you
Yeah.
never know what people's goals are, and you might not even know like what the system is gonna actually do for you, right? Like that's what's so interesting about this is it's not a one size fits all. I mean, we talk about that a lot. Uh,
Right.
and everyone's goals are a little bit different. And finding what system works for you is really important.
I remember the first night that I had automated insulin delivery in 2017. I went to bed and I remember waking up and I was like, oh my gosh, I slept through the night. I feel so rested. And I was like, that was amazing. And
Right?
then I went to bed the next night and I was like, oh my gosh, the same thing happened. And I think that's one of the things that I just love about, automated insulin delivery and about the 780 is I just, you know, um, we talked about it earlier, but the ability to, have the system just doing the work for you, most of the work, not all of it, most of it, a
No,
lot of
but
it.
most of it. And the
Yeah.
peace of mind, right? Because a lot of people really struggle with type 1 or their family members with like fear of hypoglycemia overnight, right? And this was a big challenge when NPH and regular was the common method of treatment, which it still is in some places. I want to recognize that. Um, but I think we're fortunate to not have that peaking in the middle of the night anymore. I mean, I remember my parents have given me a bowl of ice cream before bed on days that I exercised just to make sure that that didn't, peak too hard in the middle of the night. But with these systems, the protection from lows, it should help reduce that hypoglycemia, fear.
Right. And one of the other things we didn't talk about with the 780, for those times when people, if a kid has had a soccer tournament all weekend, or I did the JDRF ride in Amelia Island a couple years ago, and so I'm not a cyclist, but I rode 75 of the 100 miles, so I
Wow.
was really proud of that. And so the 780 has a temporary target. So the temporary target is 150, and that can be used for exercise or other times that you want glucose to be a little bit higher. And it can be set for anywhere between 30 minutes and 60 minutes. I'm sorry, 30 minutes and 24 hours. Um,
Nice.
yeah, and there aren't auto corrections when that is set. So that's another feature that I really like for exercise specifically.
Okay, so and that I love that there's a timer because in some of the other systems you could like start activity mode, but then you had to turn it off and like I would always forget to turn it back right, I don't know, just being human. Um,
Yeah.
and so I like having the ability to use it as a time setting. I think that's really
Yes. It is helpful. And sometimes during the school day, I've had parents who are like, I just, especially when, they've got a 7 or 8 year old, like, well, but I want them to, they have a substitute teacher today. I want them to be a little bit higher. Fine. Let's just run the temporary target until they get home from school.
yeah. Oh, absolutely. Going on a field trip,
Yep.
few hours really is not going to make a difference.
Diabetes camp. I just a couple weeks ago
Yes.
was at diabetes camp, and that was, oh, I love diabetes camp. I've volunteered at diabetes camp for years. But yes, using the temporary target basically pretty much all the time, unless it's a rainy day where they're doing arts and crafts. But otherwise, yes, we were using a lot of temporary target.
Yeah, and diabetes camp is so, oh my gosh, this could be a whole tangent, but it is so different now with all of these systems. I mean, and this year we used a thing called Camp Views where you can see,
We have the same thing.
yeah, and I mean it's just incredible. Like we are so fortunate and these kids are fortunate to have access to these
Well, and I
different.
have a funny story about that. So in the past, right, as the, doctor educator who's managing different cabins, you see the kids before every meal and you
Right.
figure out how much they're going to eat and what their insulin dose is.
Yep.
Well, so in the past, what would I do? Well, whoever was highest, I would have them get their insulin first. And now, I mean, basically, we had about 150 kids during our week of camp. And I mean, there were fewer than 10 on injections,
Yeah.
and basically everyone else was on an automated system.
Yep.
And so before the meal, I'd be like, okay, is anyone over 200? And it was kind of rare. And if
Yeah,
somebody was, I was like, okay, are you out of insulin? Like, do we need to change your site?
right.
So it really is, it's really amazing. And I just think about, thinking about all these kids and having to have diabetes for a lifetime or until we find a cure,
Yeah,
that able to really have tighter control of the glucoses, but
right.
not having to do, as you mentioned, all of the work that had to be done in the past is really just amazing.
Right. Well, and it helps, for families who, don't have as much support or they don't have, as much capacity to do like the intensive management, right? So, we're seeing all kinds of people benefit from these systems. And with that comment, I want to ask, who do you think is like the ideal candidate for the 780G?
Well, I believe in automated insulin delivery basically for everyone with type 1. And the research that I did before joining Medtronic was starting children, intensively managing glucose and starting children on AID within a month of diagnosis. So as far as who do I think is an ideal candidate for the 780, it is approved in the US for people living with type 1 diabetes, 7 years of age and older. And I feel that nearly everyone in that bucket, 7 years and older with type 1 diabetes, is an appropriate candidate. And I want to highlight a couple of groups that we might not have considered in the past and just a little bit of research surrounding that. There was a study that was done in New Zealand with a group of 13 to 25-year olds who were really struggling with their diabetes management.
Mhm.
A1C at baseline was 10 and a half. Okay. And so these are, teenagers and young adults who are struggling to remember to give their injections and all of that. So they started on the 780, and within 3 months, their A1C went from 10.5 to 7.6.
Oh
Right
my
now,
God.
this is a group of people that in the past you might have been like, I'm not sure if a pump
Right.
or automated insulin delivery is better. But for them, the 780G was much better than doing MTI. And even in a group that was really struggling, they miss boluses still. It's not like their behavior changed. The other question is like, do you have to carb count accurately? And I would say earlier on, in the past with pump systems, you had to be more precise. But there was another study that was done basically randomizing people to either precise carb counting or meal estimation, basically small, medium, and large.
Hmm.
And it was a 3 month study, but then went up to 12 months. And the group that basically did small, medium, and large, their time in range was 73%. The group who did precise carb counting, their time in range was 80. And so what it says to me is, guess what? If you want a precise carb count, great,
Yep.
the system works. If you want a meal estimate, great, 780 works. And so it
Right.
really is works for a huge variety of people. I always doesn't matter who you are, where you come from, what language you speak, what food you eat. It can help nearly everyone living with type 1 diabetes.
Yeah, and I love that. I mean, it was definitely not the mindset, before. And, maybe there were some concerns, there were less safeguards in place, whatever. But, I am a huge believer in, any amount of CGM is better than no CGM, and any amount of automation that we can give people is better than no automation, right? Just, again, easing that burden. I think that's something when you live with diabetes and you work in diabetes, like we really get that part of it.
Because like the little wins are actually the big ones.
They are. No, it's really true. And you have to celebrate, like the days where you get, over 80% time in range. I mean, that's amazing. Like that would have been unachievable, 30 years ago.
Totally. And I mean, it's not uncommon now. And there are
Right.
days where, we see people post on social media days where they have 100% time in range. Right. And
Yep.
I have to admit, like, if I look at that and I'm having one of those days, it's pretty exciting.
Absolutely. I know I had one day on it because I think I wore the system for, I don't know if it was a month or two. I think it was a month. And I had one day and I took that screenshot and I will
Oh,
forever
yeah.
keep that. Like, it was,
Right.
just something I never thought with diabetes that I could achieve, you know, and that really does like that. It changes the way that it gives you more resilience, right? It gives you empowerment, right? These are like really powerful emotions to be able to give people
And
with a
confidence.
yes,
Like I can manage my diabetes. I can do this,
right?
right?
Yeah,
And
because we have it forever. We got to keep
it's
doing it.
forever. And I've heard some people say, well, diabetes is a marathon. The thing is, I've run one marathon that was on my bucket list many years ago.
Good for
I
you.
ran it, I finished it. But diabetes is actually more than a marathon because a marathon does end,
Yeah,
right? It has a finish line and diabetes doesn't. And so those things, resilience, confidence are incredibly important.
absolutely. And so, speaking of confidence, I would like to ask if you could tell us more about the new CGM.
Yes. So, well, I'm excited. And when you say new CGM, there are actually t- two different new CGMs
Oh, okay.
that we're working with at Medtronic. And so we're incredibly excited to just have received approval for Simplera. And so we're excited. It's disposable. It's all in one, no overtape. So we're really excited about that. Now, the other thing that we've just recently announced is a partnership with Abbott. And so Abbott is actually going to create CGM that is just for Medtronic smart dosing systems.
Okay.
And so we are going to integrate that into all of our smart dosing systems. So
Nice.
people have options. We are going to go forward with both, and we're incredibly excited, just excited about the future.
Yeah, that's amazing. That's really exciting. I love yeah, because it's not a one size fits all, like we said earlier, you know, so having options is incredibly valuable. And you know, yeah, I think one of the biggest challenges with the pass sensor was just like, you know, the G6 for Dexcom, having that reusable transmitter. You know, people lose those transmitters and then, you know, it's expensive to replace them.
People want options, and so we're incredibly excited to be able to do that. We're looking
Yeah.
forward to it.
Absolutely. And then, you know, just because we touched on it, could you tell me a little bit more about the InPen? Because I think it's also a really great product for people who are not interested in being, you know, on a system with a pump.
Absolutely. So, as many people know, in pen, smart dosing, and I think that really it gives the person with diabetes a lot of information that sometimes in the beginning you might not necessarily realize that you need. But when you live with diabetes and are doing multiple daily injections day in and day out, did you give your dose at noon or did you not?
Yeah,
Right. And it's really incredibly helpful. It's also incredibly helpful for the healthcare provider because you know what it's like if you have a person with diabetes and they come in on multiple daily injections and they're not using in pen like and you're trying to figure out, well, how often do you think you remember your breakfast dose? How many injections do you give a day? I don't know, maybe two, maybe three, and it's all right there. And then also when it's all right there, the healthcare team knows exactly when the injections occurred. And then, hey, you are giving your injection every day at lunch, but you're always high. I think we need to strengthen your carb ratio. And it helps the team make a better decision. It helps the person with diabetes have a better outcome than just trying to do things blindly. So we are also incredibly excited about launching our Simplera because we know that one size, as you mentioned, doesn't fit all. I am an AID believer personally and professionally, but I also, in my own journey, I did MDI for 19 years. And I appreciate that there are a lot of people that is the path that they choose. And we want to make sure that we provide them with the, top of the line for people that choose to do multiple daily injections as well.
absolutely. And I mean, I think that's something that would be also incredibly useful for people who want to take like an AID pump break, right? Because there are times, you know, maybe you know, I took like a 4 week, 5 week break. That's all that I made it a couple of years ago, trying to clear up some scar tissue, right? And I was like, you know, I'm going to inject in locations where I don't put my infusion sets, just give it some time to like rest. And it was really helpful, honestly. So I think, you know, having more tools available is always beneficial. I think it's amazing just having all kinds of different tools for people with diabetes to help make their lives easier. Really appreciate all that you're doing, all that Medtronic is doing, and thank you so much for sharing all of this with us today.
Oh, thank you, Marissa. I have really enjoyed my time chatting with you today. And I certainly appreciate, and so does Medtronic, all that you are doing at Children with Diabetes to help people with diabetes of all ages, not just children anymore, live better lives. And so it really has been a pleasure being here with you today.
Well, thank you so much and look forward to hearing from you in the future.
Sounds great.